are back here on Healthy Living. We are here with Dr. Drew Matthews, and we're talking about summer. Summer fun, wonderful pieces and parts of summer, but also part of enjoying summer is being aware, being educated, and not being naive to things that can happen. We were talking about heat stroke in our first segment, and I kind of want to shift and segue to, I guess, critters and things, because that's kind of fun. On Hilton Head in the Lowcountry, it's oysters. I had a young woman that I know that got smacked by a manta ray, had a little concussion. So just things that you don't really think about. A lot of fishing hooks we've sniffed out. So talk to me a little bit about some things that are emergency department worthy, if you will.
Yeah, I think the more common we see is the stingrays. People are in shallow water. It can be up to the ankles is all, and they're walking, and the barb from the stingray will slash them and then actually stick them. So it's a two-pronged injury, if you will, and that's a lot of pain as they inject their venom. Yeah, so we neutralize that venom with warm water. So we actually, we have, I think, 10 to 12 green buckets that we bring out, and a lot of people will sit in groups and talk about their experience and how miserable they are as they try to neutralize the toxin. Just 90 minutes of the warm water, usually it goes away unless it's real deep. And these are most common to the lower extremities.
That's what I would say. Where am I getting this? And I know that there's the shuffle, the stingray.
Yeah, stingray shuffle, just do that so that you will make them, because they're very shy creatures. They don't want to sting you. They don't want to waste their venom. So any way to disturb them so they know, hey, something's coming, so they go away. Because it really is just a shock to them also. And when they put this venom in you, they describe it as electrical kind of pain, if you will.
So would you call that an emergency?
Oh, absolutely. So we can definitely help with manage that, because unfortunately a lot of these have lacerations, which we give antibiotics for. We don't normally sew them up acutely because infection rate's higher. We worry about pieces of the barb getting stuck in the wound, so we will x-ray to make sure we don't see any particular matter on there. And then unfortunately the other day I had one that actually lacerated a tendon, so she couldn't move her great toe. So they can get quite deep. So anyone in the lower extremities, we certainly want to see. If it goes higher up, it's really an emergency. So if you have some in the thorax, so if you're waiting on your hand or like that, which I wouldn't advise you to do all the time, but unfortunately if you get in the thorax, that can be something very serious. So that could be even going to the operating room. So definitely any stingray injuries we'd love to see. Jellyfish is another one. Same idea, it's a venomous, and we
wrap the
so the tentacles may come off, and then we just pull off the main one, and our paramedic colleagues know how to do that, and we take a credit card or something, an ID, to kind of scrape them off. Yeah, because you don't want to squeeze because it can push more venom in you. It's a very painful, these pneumocites, and we treat it, guess what? Same way, warm water.
And we know that snakes, we don't have a lot of venomous snakes, but we know we have rattlesnakes, we know we have copperheads, and I would say...
Yeah, we love the snakes. Snakes are fun.
That's such an that's such an ER doc thing.
Same idea. The snakes don't want to bite you, right? So I always tell the most common person bit by snake is usually a male on his hand who's drinking alcohol. So we don't want to be that person. Leave the snake alone. Now, unfortunately, if you reach into something for your golf ball, you may not realize there's a snake there. So I usually try to make a little noise, hey, snakey, snakey, before I get my golf ball. But I'm always in the fairway, so it's not an issue for me. So they don't want to bite you. Typically, the very small ones are the most dangerous. They actually will kind of give all their venom. And we just see if there's swelling. If the swelling goes over a major joint or progresses, then we have an anti-venom, and we can treat that. That's what we do here.
Things like brown recluse spiders. I think that's something that's such a random thing, and I know they're tiny little things, and often with people who are moving or, hanging things up, they get bitten and aren't quite...
Yeah, so I trained in Texas. We had a lot of brown recluse spiders in Oklahoma. It's one of the most common. I have not seen one in this area. I don't know if they are endemic in this area or not. But then you can find one. So brown recluse.
Designer.
Yeah, there you go. You know it all. That's true. So usually they're a tethered web, and it's woodshed or some kind of in the backyard kind of issue. That's where they like to house themselves. The brown recluse just give it a necrotic lesion. So their bite, give a venom. It's localized. Rarely does it get systemic. We do check for things can cause some renal problems and such, so we do some baseline labs, make sure nothing out of whack, and then we watch the wound. And you just treat it with, not antibiotics, don't help, it's really wound care and maybe hyperbaric. But it will spread in the gravitational pattern over weeks. But nothing deadly with a brown recluse.
This is so interesting and important. We're going to take one more quick break, and we're going to come back, and I would like to talk, you mentioned something, alcohol, cars, fun, radio, summer. Stay with us. We'll be right back here on Healthy Living to talk about some of these things.